Urinary incontinence. Oh, it's one of those topics like gut health or weight balance that often gets brushed over in a quick GP visit, or worse, ignored completely. That's probably because we're a little bit embarrassed to bring it up. But did you know that more than 1 in 3 women will experience an overactive bladder in their lifetime? Urinary incontinence is a massive issue, and after the age of 70, that number jumps to 40%, and with over 55 women over 80 also being affected. So here is the real kicker. Most of us believe the myth that urinary incontinence is just an inevitable part of aging. But is it? Today we are diving deep into the science and solutions with Dr. Shelley Casperson, a urologist amongst many other things. Dr. Casperson, it's wonderful to have you with us, and I know people are going to be madly searching to find you after this conversation. But let's get straight into the bladder, shall we? It's a big issue for a lot of women as we get older.
It's a big issue. Nobody talks about it. Women think they're the only ones. They suffer for years. Usually the stats here are women have it for about 7 years before they seek care and options.
Oh, my goodness. I'll be honest, I had 2 Caesars because, for other various reasons, I thought it might save me from incontinence. Yeah, no, I still can't laugh. I can't sneeze. I'm very careful
Yep.
on a mini tramp.
Yep.
These things affect every woman. We can say 1 in 3 may as well be everyone, right?
Yeah, and as women get older, it's actually one of the top causes, if not the number one cause of the reason that people end up in long-term care homes.
Because they
That's
just
that's a problem.
that is a problem, and we know how much stress is on those systems as it is. So
Mhm.
it affects everyone, but I'm sure the symptoms behind incontinence is many and varied.
Yeah. So for people who might not know, when we say incontinence, we mean bladder urine leakage when you don't want it. So it's not when you're just peeing,
Mhm.
it's when you don't want it. So that's what we mean when doctors call it incontinence. Urine comes out and you did not want it to come out. So that's bladder leakage, bladder incontinence. Two main types, there's more types, but they're a little, they're nuanced and more rare. But the two main types are stress incontinence, which means a force or a stress on the pelvis. So cough, sneeze, trampoline, running, CrossFit, jumping jacks. That's your classic leakage after a child. Like you said, C-section does have a lower incidence of stress incontinence because there is something about just putting the baby through the vaginal canal. But it's a change in the pelvis. It's a stretch of the pelvis. And we never go perfectly back to how our body was before we had a baby, no matter what the type of delivery. So that's stress incontinence. And then there's overactive bladder or urge incontinence. And that's more urgency, frequency, leak on the way to the toilet, leak with the key in the lock, leak with the running water, leak when you aren't expecting it. So about a third of women who have bladder leakage will have both types. When you have both, it's called mixed incontinence. The urge incontinence tends to be more bothersome. And the reason is you usually know when you're going to cough, sneeze, or go on a trampoline, and you can do something about it. You cross your legs, blah, blah, blah. But the overactive bladder can be out of the blue, come without warning, a big gush in the line at the supermarket, very, very bothersome because it's a lot less predictable. So when women, and the reason we break it down, why do we break it down? It's urine that leaks when you don't want it to, right? We break it down because the reasons that it happens is different, which means the treatments are different. So when women have both, I usually say, which one bothers you the most? We're going to go after that one first. We might have to do more if you want to get it as maximally treated as we can.
Either are going to cause you huge issues, aren't they? Mental health issues. We can link it to depression, anxiety, and as you say, as you get older, that feeling of isolation. I can't go out. I can't go to the gym. I can't be guaranteed to make it through a dinner without needing to rush to the bathroom. That's going to have huge knock-on effects for your psychology.
Yeah, they actually have studies that women's sexual health is worse when they have bladder leakage. They're self-conscious, I don't want to leak, it might be embarrassing. And so the treatments for incontinence, when you do that, their sex life actually gets better. And likely the reason is better confidence that you're not going to have an issue when you're being intimate.
So what actually happens in the body? Can you break down the physical side of this, as you said before, stretching of the pelvis? What else is going
Yeah.
on down there?
Yeah, so a lot of things actually need to work well in order to not leak urine. So what that means is there can be a lot of different things that go wrong when the leaking happens because it's not just one thing. With the stress incontinence, the urethra, which is the tube that you pee through, the urethra when you cough, sneeze, laugh actually kind of hits the pubic bone and acts as a backstop. After a baby comes through, it can kind of lower a little bit and just not have as much support around it. Collagen, we lose our collagen as we get older. We lose our pelvic floor strength, just like we lose lots of strength as we get older. And all those things can affect stress incontinence. Overactive bladder, they're not fully sure. Again, it's probably multiple things. We know that it becomes much more common after menopause when our hormones go down. So the role of estrogen, vaginal estrogen, is actually as effective as the overactive bladder medications. They all have different names. Here, the common generic ones are like oxybutynin, ditropan, tolterodine, if you guys have similar names for that, which they're nasty meds. You know, they're actually not great for brains. They have a high risk of falling, dry mouth, constipation. It's good to know that vaginal estrogen is about as effective and has none of those side effects. So I always start women when women come in, pelvic floor physical therapy to get your pelvic floor strength better, vaginal estrogen. Those are my basic, non-operative, very safe. I basically tell women we're going to try to restore your natural function first before we get into things that are unnatural, like procedures, surgeries, and then the nasty medications.
At the Aging Project, we believe everyone should have the opportunity to understand their genes, and we've created a program to help you do just that. Over the past 3 years and 100 plus podcast episodes, we've interviewed world-leading longevity experts, many highlighting the power of genetic insights. But when we went searching for the best DNA testing option in Australia, we hit a dead end. If DNA knowledge is so vital, why wasn't there one trusted company offering the best test with the best insights? So we built it for ourselves and for our families and for you. We're incredibly proud of what we've created because we know that it will change lives, including yours. We've partnered with FitGenes, a world leader in genetic testing, to bring you Australia's most advanced, science-backed DNA program. It isn't just another health trend. This is a once-in-a-lifetime opportunity to discover your DNA and how to use that knowledge to make better choices. For the first time in history, we have access to the power of genetic testing, something no generation before us has had. So stop guessing what your body needs when a DNA test can give you personalised insights. If you're ready to learn and discover 200 healthy aging genes, join us for our free DNA webinar to learn why your genetic blueprint matters. Visit theagingproject.com to register. And because we want you aging well alongside us, we will send you our exclusive Stay Well scorecard bonus. This will land in your inbox just after the webinar. This is game changing. It's a resource that includes markers we want you tracking every year, starting now. It includes 50 blood markers, 5 critical health markers, including blood pressure and bone density, 9 general health indicators, and 4 mobility markers. This I cannot wait to share with you because it is life-changing information. Join our free DNA webinar, register today, and we'll see you soon. Which we're all about that at the Aging Project. We're about taking control of our health. You mentioned estrogen before, and again, so we're getting used to this idea and encouraging people to explore those HRT options that are available that, again, have been a little bit, in the black book, I suppose, for a while now, but coming more to fruition. And I've heard you talk about the fact that hormone replacement therapy was huge in the 90s, but has then had a bit of a dark age in the meantime.
Yeah.
But we're coming out of that now.
Yeah, we're coming out of it. So vaginal estrogen, just to clarify for people, it's just skincare, right? So it's helping you put it in the vagina and bladder share a wall. I say they're condo mates, right? They share a wall. So you put the estrogen in the vagina, it kind of gets into the bladder that way. The bladder has estrogen receptors in the smooth muscle, the part that squeezes. And so it gets more spastic when it doesn't have the hormones that help it function normally. So that's why vaginal estrogen helps the bladder. But vaginal estrogen itself is very low. If I was to take a 65-year-old woman, put her on vaginal estrogen and check her blood levels of estrogen, I wouldn't know she was on vaginal estrogen. It doesn't even raise your levels. It's so low dose. A year of vaginal estrogen is equivalent to 1 pill of oral estradiol. So it's incredibly safe. It's nothing. And you guys, Australia has the same problem or issue that we have, is that after the Women's Health Initiative in 2002, our government put a big warning label on these products. They didn't care what type, what dose, what formulate. They didn't care. Everything got this warning label on it, including vaginal estrogen. So vaginal estrogen, which doesn't go into your body in any measurable amount, has warning labels that says heart attack, stroke, cancer, blood clot, probable dementia. Not possible, probable. That's what our warning label says. So if a doctor doesn't say, listen, this is entirely safe, this warning label's wrong, women will go home and they'll be like, my doctor's trying to kill me. This is not worth it. And my friends actually did a study and they said about 23% of women will get a prescription for vaginal estrogen and still not use it because they read the warning label. So we're doing a grand disservice by having inaccuracies in government labeling. In my understanding, I've been told that you guys have this very similar incorrect data on your vaginal estrogen.
We have, as I said, we're coming out of the dark now. And even my question to you, thinking that it might be the same as estradiol, is not. So if you're on HRT and you are using that, it's probably helping, but not as much as a vaginal estrogen would. Correct?
Yeah, the data for systemic hormones, so what that means is full body hormones, right? Whether that's a patch or a pill or whatever way you're getting estrogen in your body, in your bloodstream, that is kind of mixed data on bladder leakage. So there is some papers that say it actually can make stress incontinence worse. We're not quite sure how that is, and not everybody believes it, and that does not happen to everybody. But in regards to hormones and bladder leakage, your two biggest ones are vaginal estrogen, which is like our bread and butter. Anybody who comes into a urogynecologist office or a urologist office with bladder leakage should be offered pelvic floor physical therapy and vaginal estrogen. There's simple, low-hanging fruit. The other interesting thing, and we need more data, but there are at least 2 papers looking at the association of testosterone in women and stress incontinence. And I know several women who they kind of have mild stress incontinence after babies, blah, 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 and they got started on testosterone, not for their bladder leakage, but they're like, my bladder leakage is gone. So there is a role, probably via muscle strength. That's probably why it works, because that's, again, stress incontinence, leaking with cough, sneeze, and laugh. And we don't have any other medications that are FDA approved, our government approved for stress incontinence, because it really is a structural issue. It's hard to take a pill and fix a structure, right? So really we're left for pelvic floor physical therapy, some amazing procedures we can talk about. But testosterone has been shown to improve stress incontinence in women. It's nobody knows about that. It's not well studied, certainly not on label. But when people say that testosterone's not useful for anything but libido, I always like to pick holes in that because it's simply not true.
So maybe we'll watch this space. You mentioned some natural strategies, and of course, we've all heard of Kegels. You've got some other techniques here, which we'll talk about in a moment. But if we were going down the natural path and we weren't suffering from a huge amount of leakage at this point, but no, we're in that age bracket where the percentages are going up and we want to get ahead of the game. Is Kegels still a thing?
Yeah. Okay, so the biggest problem with Kegels, two problems with Kegels. Kegels work, but they don't work in everybody. I always joke, if Kegels worked, I'd be out of a job. So they don't work that well, but they work in some people. Again, if muscle strength is the issue behind your bladder leakage, that can strengthen your muscles. The biggest issue is that it's time intensive. You got to do a lot of Kegels and every day. And then number 2, if you weren't ever trained, a lot of people just like clench their butt and think that's a Kegel, right? Where the Kegel is actually like a lifting and a holding. If you can think of like lifting your vagina up and then holding it, or if you're urinating and you try to make the urine start and stop, that's a Kegel. So the pelvic floor physios, the physical therapists are excellent. And again, I tell my women, I'm like, listen, if Kegels worked, like you wouldn't have needed to come in and see me. You could have done that without seeing me, right? So I think to see a doctor and then have a doctor tell you to do Kegels, most people know about it. And if it worked, they wouldn't be there. But the pelvic floor physical therapist is so much more than just a Kegel. That's their stereotype they get. They're like, what are they going to do? They're just going to give me Kegels? And it's like, no, they're going to teach you all about your bladder and how your pelvic floor affects it and how your hip injury from high school affects it, right? Like it's how it's all related. Do you have tight hips? Do you have painful lower back? Like all of these things can affect the bladder. And that's why the pelvic floor physical therapists know so much. And they help way more people than just saying, go home and do some Kegels.
The fact that there is even a pelvic physical therapist obviously proves the need for expertise in this area. But again,
Yeah.
to seek that person out, is it something that a GP is going to recommend to you, or are they going to put you through all sorts of other hoops first, do you think?
Yeah, I mean, I think it depends upon how trained your community is. Like my community, my GPs, they know, they know the role of physical therapy, and they always try to get their people to go there first. But I can't say that's standard. I joke, I'm like, why would a surgeon be the first place you go for bladder leakage,
Mhm.
right? Like again, vaginal estrogen you can get from GP, physical therapy, you don't need a surgeon for. So surgeons really are like, I've tried everything else.
Yes.
What's next? Or this is bad.
Mhm.
I mean, there are women who are in 5 diapers a day, 7 diapers a day. It's been going on for years. Their skin's breaking down because they've just got so much urine that's coming out. You'd lean more towards trying to do something. Of course, we wish they would have come in 5 years ago, 10 years ago, so it didn't get this bad.
Yeah.
So it's certainly different than like, hey, I don't leak at all, except for when you make me try to do some jumping jacks and CrossFit. That's going to be a really motivated, fit person. There might be a better candidate for the physiotherapist.
And this is the thing, is that it's not going away. I would assume once you have a level of incontinence, it's not going to improve itself.
One thing that actually does, yes, that's usually how it is. But one thing that has been shown to make a big difference is if you are overweight, and I don't mean lots of muscles, I mean lots of adipose tissue, losing the weight, even losing 5 to 10% of that overweight does make a big difference. And I've talked to lots of women. I've talked to some women, they're like, I can tell. Like I can tell when I'm creeping up or I'm up a few kilo because they'll start leaking and then they lose the weight and they don't leak again. So it's really, the bladder's sitting on a pelvic floor, but there's all this weight on top of the pelvic floor. Right. And so a lot of women now, if it's just a couple of kilos, couple of pounds, it's probably not going to make a big difference. But if it's significant, I have had people stop leaking when they've lost the weight.
I could say that's got to be the greatest motivator I've ever heard
How cool
for
is that?
getting yourself
Yeah.
into better shape, isn't it? There's other things that you can say, oh, well, I'll just, I can compromise, or, I can live with that, or I'll go up a size. There's always a reason why we can't do more physical activity. But if incontinence was your main issue, I think you are going to be doing everything you can to get those walking shoes on and get out the door.
Yeah. I mean, I think a lot of people don't know that, it's, again, we don't talk about bladder leakage. And so we don't talk about these, that's why, talking to somebody who kind of knows all of it is like, did you know this thing about testosterone and stress incontinence? There's 5, it's like, we don't talk about these things very much. So I'm really glad that you care enough to have an entire episode about it.
Oh, yeah. Look, I'm blushing a little bit. And again, because it's something we just don't talk about, right? But
Yep.
I'm glad that we can be just spreading the word here. And I know that everyone's taking notes because, again, like everything, as we get older, there are so many different reasons for every different body. You've just got to find that solution that is, perfect for you. One of the things I have read is obviously reducing your caffeine as well. That's going to be a helping hand.
Unfortunately. I work in the Pacific Northwest, so the west coast of America. This is where Starbucks was born, right? We're very addicted to our caffeine. I learned many years ago not to tell people that giving up caffeine was going to be my thing. I'm like, I like people to come back and see me again.
Yeah.
So
yeah, it's not the first prescription, you're right.
Yeah, you don't make a lot of friends when you tell them to stop caffeine where I live. But to me, I just tell people it's an experiment. Cut it in half. Alternate caffeine with a cup of water. Sometimes it's just the sheer volume that you're consuming. And then again, I'm sure this is everywhere, but in the Pacific Northwest, like when people say they drink coffee, you really have to ask because sometimes it's like pots of coffee in a day, and then you're like, well, it's probably a lot of caffeine. You should get back
and just a lot of liquid, full stop. Right?
And it's a lot of liquid. Yeah. I had a guy who didn't like waking up at night to urinate, and he drank a 6-pack of beer before bed. And I'm like, well, why don't you stop that for just again, I'd never want to take people and give it a couple of days, just see what happens. And he's like, I stopped getting up to pee at night. And I'm like, yeah, Like,
This shouldn't be a revelation, but I'm glad that it was.
Yeah,
I'm glad
you
that
came
it
to a
was.
surgeon for me to tell you not to drink a bunch of fluids before night. But like, we don't get taught what normal is, right? We don't get taught, and a lot of this happens really slowly. And so you get to the point, you're getting up 6 times a night, but it took years to get that way. You don't think it's broken. But what we do know is getting up at night is, number one, it's a risk for falling as we get older. So that's very bad. And then number 2, sleep is everything. So the bladder really can disrupt your sleep cycles. And so for people who know what normal is, under the age of 65, it's considered normal to get up 1 or less times a night. And then 65 and older, because our kidneys as they age do stop concentrating as much as at night. So 65 or older, 2 times or less is considered normal. So, and that's important to know, because people will go to the doctor and they'll be like, I get up 3 times a night. And it's like, we could try to get you to normal, but I can't promise I can get you to 0 times. It's just normal physiology.
Yes.
So getting up at night to pee or urinate is called nocturia. The other tip for nocturia is get worked up for sleep apnea, because sleep apnea absolutely creates, the way sleep apnea works in creating pressure in your body is that it forces more fluids to your kidneys. Your kidneys filter more fluids. You may have more fluid in your bladder. So sleep apnea is a big trigger for getting up at night. And then stop fluids 3 hours before bed, pee before bed. I know it sounds basic and simple, but many people don't know that. No. And I always say, if you give your kidneys a job to do, they're going to give your bladder a job to do.
A quick break in today's conversation, and I know you'll be interested in this one. In my chat with Dr. Lara Bryden, we learned inositol is one of her favourite safe and inexpensive supplements to improve insulin resistance and aid weight loss. She also spoke of the benefits for PCOS sufferers. In the podcast conversation, Dr. Bryden told us inositol has been researched for women in perimenopause and menopause for insulin resistance and been clinically trialled and found to be effective, and is one of 5 missing metabolic nutrients that women need. This is the reason why we've always stocked inositol over at youmusttryit.com. So ladies, if you're worried about abdominal visceral fat, search for inositol over at youmusttryit.com before they get snapped up.
Very, very true. And it is that thing, isn't it? Just because it's common doesn't mean that it's normal. So if you are having these conversations with your girlfriends and they're saying, oh, I go 3 or 4 times a night, and, you have sort of this consensus that that's normal, that is not normal. And you all need to do a little bit of work to bring back the normal.
I mean, that's the number one question people ask is this normal? And so many times doctors will say, it's common, but it's not normal.
No.
Yeah.
And we know from the stats that we mentioned earlier that we are all likely to be affected by this down the track, or where we are right now. If we're not seeing someone about it, and again, we're trying to take those steps to prevent having to take more action. Cranberry powder. Can you talk to me about cranberry powder?
Yeah, cranberry powder, there's multiple studies. Classically, you think about cranberry for urinary tract infection prevention. Data's mixed. They'll come out and they'll say it helps, and then they'll come out and say it doesn't help. I think it does depend upon the quality of the product. Is it made from the actual, component of the cranberry juice that it helps prevent infections? Or is it just, in America, our supplement industry is totally unregulated, right? So you can say cranberries on the bottle and there is no cranberry in the bottle and nobody's going to get you in trouble for it. So I know. It's a Wild West.
Podcast for another day.
That's a podcast for another day. So, a lot of people, when they'll say, studies don't show that the cranberry helped, is like, was it a product that had good cranberry in it?
Yeah, so we're just drinking some cranberry cordial off the shelf.
Yes, exactly. So I usually tell people, because people want to know what they can do to decrease urinary tract infections. Number one, nothing works better than vaginal estrogen. It decreases UTI by 50 to 60%. Nothing else comes close. Staying well hydrated and urinating regularly. Daytime urination 6 to 8 times a day, every 2 to 3 hours. We never got taught that. So many women are like, I pee twice a day and I'm getting urinary tract infections. It's like, well, dude, dilution's the solution to pollution. Like, get it out of there.
I was going to say clean the machine, but you've just upped me by 2 there.
Oh, I like that one. I'm going to take that one. That's good. So cranberry is good. You want a high quality product. Vaginal estrogen, absolutely. There is some some data on D-mannose. It's a supplement. It's a polysaccharide that actually works by making the bacteria not stick to the lining of the bladder. And then drinking water. They did a trial. They randomized women to telling them nothing versus drinking 1.5, I think it was 1.5 liters a day. And just increasing water consumption decreased the UTIs significantly.
Amazing.
So again, it's the people who are holding their pee, they're dehydrated, and they're upset that they have UTIs. It's like, clean the machine.
Okay. So, dilution is the solution. So we've got doing a wee 6 times a day, doing a wee at night, maybe 1 to 3 times, depending on your age.
2 or less.
Yes.
After age 65.
After age 65. Okay. We're also reducing our adipose tissue, which is exercising.
Stay at a normal weight. It's a good question for people to be like, okay, I'm good right now. How can I stay good? Right? And people are like, tell me how many Kegels I have to do a day. And I'm like, I'm not sure it's so much that you need to do Kegels, but it's like when your hormones change, at a minimum, vaginal estrogen, it's preventative healthcare. It's so safe. It's so cheap. We have government health insurance for age 65 and over. It's called Medicare. And they did a study and they said if we gave vaginal estrogen to every woman 65 and older, and they used it, caveat, it would save us billions of dollars a year just in the reduced urinary tract infections. I mean, let alone the overactive bladder and
everything
all
else.
stuff.
Because okay, so it's just moved up the top of it's just bouncing its way up to the top of the list now.
I just tell people, I'm like, it's like sunscreen and seatbelts and vaginal estrogen. Welcome to age 50.
God. This is awesome. Thank you. This is great information.
It's so good. It's so safe. So that's what I would do. And then keep your muscle strength. Actually, grip strength is correlated to bladder leakage. So the body muscle that you have helps protect you against bladder leakage. So stay strong, stay hormonally replete, stay a healthy weight. And again, the other things would be, treat any chronic cough, chronic constipation, anything that's a big stress or force on the pelvis.
Can I go back to grip strength for a second? Are you saying, like, if I've got strong grip strength, I'm going to have good grip strength? Or does this come down to this marble technique I've been hearing something about?
You have to think, like, researchers, it's a lot easier to measure how strong your grip is than how strong your vagina is or your pelvic floor.
So you are talking about physical hand, gripping a pencil strength.
Yeah.
Nice.
You know those like little extra squeezy exerciser things?
Yes.
There's machines that can measure how strong your hands are. And so grip strength is correlated with decreased bladder leakage, probably as an overall marker of how much strength your body has.
Or we're gripping and we're flinching and we're squeezing all at the same time.
Maybe. But yeah, too tight. And so many people, they'll think tighter is better, and the pelvic floor physical therapists are like, no, you don't want to be squeezing all the time. You hurt yourself. It's just overall like ability that you're strong. You have good muscle mass is what's protective.
Good to know. Okay, we're all going to be getting those jar lids
off.
We'll never be the same again. That's exactly right.
Don't forget to alternate hands.
Let's talk about those medical interventions. Obviously, surgery is, as you say, that one thing that you would avoid at all costs. I guess in any form, any sort of surgery is something that you would like to avoid at all costs. Do they have a good success rate? Do they wear out again as we age more? How does the surgery actually go? What's the success rate?
Well, let's talk about stress incontinence first. So again, stress incontinence is leaking with cough, sneeze, laugh, childbirth, trampoline. So that's the force, right? So what you have to do is you have to create more resistance. So whether that's pelvic floor physical therapy, right? But when you get into procedures, the classic one is called the mid-urethral sling, transvaginal tape, a mesh sling. There's lots of names that people use about that, but it's basically like an index finger length and width of a piece of mesh tape. You make a little incision under the urethra, put it in, it acts like a hammock. So like I said, that when the urethra, when you cough, it used to hit the backbone and that would help it not leak. Now you're putting in the tape so that when you cough, it's supported and doesn't leak. That's been around for over 20 years. Very safe, very effective, but it is a surgery where you need anesthesia, no lifting for, over 10 pounds for about 4 weeks, no sexual activity because you got an incision you're healing from. There's always a risk long term. If it got too tight, you need a surgery to loosen it, or if it could erode into the bladder or the vagina. Pretty rare, but it's like a knee replacement or a hip replacement. If you put something in, something can happen. Infection with that's very low. And so that's what we did. Everybody did that. They did the slings because, like I said, Kegels don't help everybody. But now we've got this new thing, and we should have looked to see if does Australia have this. You probably do. Europe has it. It's called Bulkamid. And so Bulkamid is basically, the best way to describe it is like people who get fillers in their face, not Botox, fillers. So I want my lips to be more full or my cheeks to be more full, fillers. It's filler for the urethra. It's very simple. It takes about a minute. We still do a little bit of anesthesia because it's a needle in your urethra, but it's adding resistance. It's adding volume. So the loss of collagen, the loss of support, we're adding it back. It's a game changer because there's no downtime. Go work out the next day, go have sex the next day. No downtime, no possibility of mesh erosion. The only change would be it's not going to be permanent for you. Your body's going to absorb it back. You're going to need it. It's just like fillers for the face. At some point, you'll need more if you want to keep it going. That's how filler is. But it's a game changer. I've been doing it now for about 3 years, done hundreds. And I went in being like, I don't know if it doesn't work. I'm not interested because there are some older fillers that people used to use that they just did not work well. And so we were kind of skeptical going in, but women are like, I love it. No downtime, no pain. I had a woman teacher yoga class that night. Like they do so well with it. And even if they do have to get it repeated, it's usually, a year or two apart. So it's not this, every 2 months sort of thing. So Bulkamid really is the game changer in the last couple of years for stress incontinence. It's keeping mesh out of a lot of pelvises.
Which I think, again, if you had the choice, you would opt for that Bulkamid first and give it a go.
Yeah.
Yes.
Yeah.
Okay.
Slings won't go away. Some people just need the strength of a sling. Right. But I usually say try Bulkamid, try it twice. And if it's just not giving you the control you need, you've bought yourself a sling.
Okay. So what about urge incontinence? What should we be doing there if we're heading down that surgical pathway?
Yep. So first line, again, is all of those lifestyle behavioral things, vaginal estrogen. Second line is medications. There's 2 classes of medications. One is the classic anticholinergics, again, oxybutynin, ditropan, been around for decades. Not great meds, kind of dirty. They go all over the body. They got lots of side effects, but cheap. So that's why people still use them. They don't work great. Most women don't like the side effects and stop taking them. The newer class of medications are called beta-3 agonists. In America, those are called Myrbetriq and Gemtesa, or Mirbegron is the generic. They work pretty well. The worst part here is they're expensive. Okay, those are the meds. The procedures are, and I call them procedure because you don't really need, it's not like they're not huge surgeries. But my favorite is Botox. So Botox is used medically all over the body, right? It's used for migraines. It's used for spastic muscles. So not just cosmetically, but you put a little needle in the bladder through the urethra after you numb it up, and takes about 1 minute to do bladder Botox. And it works for about 6 to 8 months on average. And women just say the classic thing is, I just have more time to get to the bathroom. So they love it. It's a game. I mean, so many people, it's a game changer. And my women, because they see me, like they're already on vaginal estrogen. They've done the physical therapy, right? And so they are really at the point with Botox, and they're like, it's a game changer. I can leave my house. It's awesome. If it's really bad urge incontinence, leaking from sitting to standing, that's a tricky one. So if it's really bad urge incontinence, then we go to what we call sacral neuromodulation. You're basically stimulating the bladder nerve. And there's a couple of different ways to do that in the body. A couple of different procedures. You can stimulate it through the ankle because it's the same nerve. You can stimulate it through the back, kind of upper buttock. So a couple of different companies that have bladder stimulators. The most invasive, but it's the big gun for when everything else hasn't worked. It can be, I've got women, they couldn't leave their house because it was so bad. They're getting up 10 times a night.
That's heartbreaking. Kelly.
Oh, it's awful.
Isn't it?
Yeah, people don't know how bad it can get, So people are like, "Oh, we want surgery." It's like, when it's bad enough, you want surgery.
You want it, yeah.
You're just like, "Please give me something that can make this better."
Mm-hmm.
And sacral neuromodulation, again, it's been around for over 20 years. Nobody knows about it. It can be a game changer for people. So my advice for women is, again, start with the simple low-hanging fruit, but then see somebody who's really trained in procedures for the bladder, because they can be game changers.
This has been a real eye-opener for me. I was really naive to this topic before we started talking about it today. I think it's going to be really helpful for so many people listening, and everyone's going to be, as we've said, at a different level. But we've all had that moment, whether it's a good laugh with a friend or a big sneeze. I'm sure we've all been there, and it's something you would, try to avoid at all costs, and knowing that it can get so much worse without some sort of intervention, some of which we've spoken about today, is possible for ourselves to take on board and to take charge. But to know that there are these seemingly simple remedies or solutions that can give us that respite is wonderful news. And I know that, again, if you were one of those long-time sufferers that was perhaps a little bit too embarrassed or hesitant to ask, even if the symptoms were small, to hear this today and know that there's so much great help out there is awesome.
Oh, yeah. I mean, it's some of the most fun work I can do, because it's so rewarding to see women get back their ability to be physically active, their ability to go on walks, to go on hikes, to leave their house. So it's quite rewarding, because what we have, again, nothing works in everybody, right? But the success rates are pretty high.
Well, you're coming out here to Australia very, very soon to talk all about this and so many more great topics. For those who can't make it to see you, your Instagram is a wonderful place to follow you and to hear your daily tips and tricks. And you've got some great interviews there as well as Kelly Casperson, MD.com. Great information there on your site. And tell us about the Casperson Clinic.
Yeah. So this year, 2025, I actually backed off from full-time insurance-based, not to bore you with how bad insurance is in America, but really to spend more time with women, to give them the space to be seen, to be heard, to really slow down, right? To really slow down and give people individualized care, specifically for sexual health and hormone health. I installed the espresso maker today. So that means it's getting close to being open.
But not too many, and make sure it's decaf.
But not too many. Switch to decaf after a certain point.
And what are you going to, you can come there as an appointment. Obviously here in Australia, that's going to be hard for us to access.
It's going to be very hard if you're in Australia. I probably wouldn't recommend the flight.
Might you be starting? Yeah, just for that, because you will need to use the bathroom. Yeah. Will you be doing some clinics or some online clinics perhaps for us in the future?
You know what I'm thinking about? I probably will do it this year, because the demand is just so high, is to do some like live webinars on the ones I have so far in my head are testosterone, guidelines for menopause. Those, of course, sex ed is always a great topic. So nobody got sex ed, right? We got disease and pregnancy prevention plans. That's not sex ed.
So true. So true.
So that one might be a fun one too to do.
Well, sign us up, Dr. Casperson. We will be there with bells on. It's been so lovely chatting to you today. Thank you so much for your time.
Thanks for having me.
Ladies, this is an episode every woman needs to hear. So please share this conversation with literally every woman you know, because knowledge is power, and too many of us have been left in the dark when it comes to our bladder health. You can find this episode on the Aging Project YouTube channel. Make sure you follow and subscribe so you never miss these important conversations. After interviewing over 100 experts, here's what I've realised. A lifetime of 15-minute appointments has left us uninformed about our own health, and that's the truth. We've been taught so little about how our own bodies work, how to prevent issues, or how to take charge of our well-being. Our GPs do an incredible job at diagnosing, prescribing, and treating, but prevention, staying well, right now, that's on us. And as we age and our risk levels rise, it's a job we can't afford to ignore. So to the women suffering with bladder issues, you are not alone and there is hope. There are things you can do. To those with mild symptoms, don't wait. Take action now. And to those lucky enough to have no symptoms yet, protect your health before problems arise.
A huge thank you to Dr. Kelly Casperson for sharing her wisdom, empowering us with knowledge, and helping us to make better choices starting today. I'm Shelley Craft. Thank you for being a part of our community. Stay well, and we'll see you soon. As always, the Aging Project podcast is for educational and entertainment purposes. Always seek medical advice from a qualified practitioner.